Welcome to Calm Mind and Healthy Body, our channel. Regarding our health, medications play a crucial role in managing various conditions. However, many may not realize that certain medications can lead to unexpected side effects, including swelling in the feet and legs. This condition, known as peripheral edema, can be uncomfortable and concerning. It's essential to understand how different medications, such as those for high blood pressure, diabetes, or even certain anti-inflammatory drugs, can contribute to this issue. Recognizing the signs of poor circulation is vital. Symptoms like swelling, pain, or a feeling of heaviness in the legs can indicate something isn't quite right. Poor circulation can lead to more severe health problems if left unaddressed, making paying attention to these warning signs crucial. In this video, we'll dive deeper into the medications commonly associated with leg swelling and discuss how they affect your body. But don't worry, we won't just focus on the negatives. We'll also explore some natural remedies that may help alleviate swelling and improve circulation. Whether you're currently experiencing this issue or want to be informed, we promise to provide valuable insights that empower you to control your health. So, stick around as we uncover the connection between medications and leg swelling and share some practical tips to help you feel your best. Your journey to understanding and managing this condition starts here. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support! Medications that cause swelling. Swelling in the feet and legs can be an uncomfortable side effect of various medications. Understanding which drugs are commonly linked to this issue can help you stay informed about your health. Here are 7 medicines that are often associated with swelling. 1. Non-steroidal anti-inflammatory drugs, NSAIDs. Commonly used for pain relief, NSAIDs like ibuprofen and naproxen can lead to fluid retention, causing swelling in the lower extremities. 2. Corticosteroids. Medications such as prednisone effectively reduce inflammation, but can also cause the body to retain sodium and water, resulting in swelling. 3. Calcium channel blockers. Often prescribed for high blood pressure and heart conditions, drugs like amlodipine can lead to peripheral edema by affecting blood flow and fluid balance. 4. Antidepressants. Certain antidepressants, particularly those in the serotonin-norepinephrine reuptake inhibitor, SNRI class, can cause swelling as a side effect. 5. Hormonal medications. Birth control pills and hormone replacement therapy can lead to fluid retention, especially in women. 6. Diabetes medications. Some medications for diabetes, such as thiazolidinedionase, can cause swelling due to their effects on fluid retention. 7. Chemotherapy drugs. Certain cancer treatments can cause swelling by impacting blood vessels and fluid balance. If you take any of these medications and notice swelling in your feet or legs, consult your healthcare provider. They can help you understand the side effects and explore alternative options. Staying proactive about your health is vital. Signs of poor leg circulation. Recognizing the signs of poor circulation in your legs is crucial for maintaining overall health. Early detection can lead to better outcomes and prevent more severe complications. Here are 7 common signs that may indicate poor leg circulation. 1. Numbness. Numbness in your legs can indicate restricted blood flow. This sensation may come and go or persist over time. 2. Tingling. Often described as a pins and needles feeling, tingling in the legs can indicate nerve issues related to poor circulation. 3. Swelling. If you notice swelling in your feet or ankles, it could be a sign that fluid is accumulating due to inadequate blood flow. 4. Coldness. Legs that feel unusually cold, especially compared to the rest of your body, may indicate that blood isn't circulating effectively. 5. Pain or cramping. Pain or cramping in your legs, particularly during physical activity, can be a sign of peripheral artery disease, which affects circulation. 6. Color changes. Look for changes in skin color, such as a bluish tint or paleness, which can indicate reduced blood flow to the area. 7. Weak pulses. If you find it challenging to feel a pulse in your legs or feet, this could be a sign of poor circulation. Monitoring your leg health regularly is essential. If you notice any of these symptoms, don't hesitate to consult a healthcare professional. Early intervention can significantly improve your overall well-being and help you maintain an active lifestyle. Stay vigilant and take charge of your leg health. Understanding lymphedema. Lymphedema is characterized by the accumulation of lymphatic fluid, leading to swelling, most commonly in the arms and legs. This condition occurs when the lymphatic system drains excess fluid from tissues and becomes damaged or blocked. Causes of lymphedema include genetic factors, surgery, radiation therapy, infections, and even side effects. Certain medications, particularly those that affect fluid balance or circulation, can contribute to developing lymphedema, exacerbating leg swelling. The impact of lymphedema on daily life can be significant. Individuals may experience discomfort, heaviness, and pain in the affected limbs, which can hinder mobility and limit physical activities. Simple tasks like walking, standing, or sitting for extended periods can become challenging. This can decrease overall quality of life, as individuals may feel self-conscious about their appearance or struggle with the physical limitations imposed by the condition. Seeking medical advice for the management of lymphedema is crucial. Healthcare professionals can provide a comprehensive assessment and recommend appropriate treatment options, including compression therapy, physical therapy, and lifestyle modifications. Early intervention can help manage symptoms effectively and prevent the condition from worsening. If you notice persistent swelling in your legs or any signs of lymphedema, don't hesitate to contact a healthcare provider. Understanding and addressing lymphedema is essential for maintaining mobility and enhancing overall well-being. Natural remedies for swelling. If you're dealing with swelling in your legs and feet, several effective natural remedies can help alleviate discomfort and promote better circulation. One of the simplest methods is elevation. Propping your legs on a pillow or resting them on a chair can encourage fluid drainage and reduce swelling. This is especially beneficial after long periods of standing or sitting. Another helpful remedy is wearing compression socks. These specially designed socks apply gentle pressure to your legs, helping to improve blood flow and reduce swelling. They come in various styles and sizes, making finding a pair that suits your needs easy. Incorporating herbal teas into your daily routine can also be beneficial. Teas made from ingredients like ginger, dandelion, or green tea have natural anti-inflammatory properties that can help reduce swelling. Sipping on these teas hydrates you and provides additional health benefits. Staying hydrated is crucial for managing swelling. Drinking plenty of water helps your body flush out excess sodium, which can contribute to fluid retention. Additionally, reducing your salt intake can make a significant difference. High sodium levels can increase water retention, so opting for fresh, whole foods over processed options can help keep swelling at bay. By incorporating these natural remedies into your routine, you can take proactive steps toward managing swelling in your legs and feet. Consistency is critical. Small changes can significantly improve your comfort and overall well-being. Home remedies for leg health. Taking care of your legs is essential for maintaining good circulation and reducing swelling. Fortunately, you can incorporate several practical home remedies into your daily routine to improve leg health. One effective way to enhance circulation is through simple exercises. Leg lifts are a great option. Lie on your back and lift your legs straight up, holding for a few seconds before lowering them. This exercise helps stimulate blood flow. Another beneficial exercise is ankle rotations. While seated, lift one foot off the ground, rotate your ankle in circles, and switch to the other foot. These movements can help keep your legs flexible and promote better circulation. In addition to exercises, warm baths can be incredibly soothing for your legs. Soaking in warm water helps relax muscles and improve blood flow. You can enhance this experience by adding essential oils like lavender or eucalyptus, which provide a calming aroma and anti-inflammatory properties. A warm bath can be a perfect way to unwind after a long day and give your legs the care they deserve. Creating a leg care routine at home is essential for long-term health. Consider setting aside time daily for exercises, warm baths, and even gentle massages with essential oils. Making these practices a regular part of your life can significantly improve circulation, reduce swelling, and enhance overall leg health. Remember, consistency is critical. Taking small steps can lead to lasting benefits for your legs. We've explored leg swelling and its connection to various medications. We discussed how certain drugs, including NSAIDs, corticosteroids, and calcium channel blockers, can lead to fluid retention and swelling in the feet and legs. Recognizing these medication side effects is crucial for maintaining overall health and well-being. By being aware of the signs of poor circulation and the potential impact of your medications, you can take proactive steps to address any issues. We also highlighted practical home remedies and natural solutions to improve leg health, such as exercises like leg lifts and ankle rotations, as well as the benefits of warm baths and essential oils. Incorporating these practices into your daily routine can significantly enhance circulation and reduce swelling, leading to a more comfortable and active lifestyle. Taking action on your leg health is essential. Whether you monitor your medication side effects, exercise regularly, or seek medical advice when needed, every step can make a difference. Remember, your legs are vital for mobility and overall quality of life, so prioritize their care. If you found this video helpful, we invite you to subscribe to our channel for more informative content. Remember to like and share this video with friends and family who may benefit from these insights. Together, we can spread awareness about leg health and empower others to take charge of their well-being. Thank you for watching, and we look forward to seeing you in our next video.